everybody. It is 6:57, and Kevin Frankish is getting his exercise. He's doing a mad dash into the lobby. Here he is.
I'm rolling up my sleeves.
Well, you should. You're with a good doctor here, Dr.
Nice
Mulholland.
to see you again. Nice to see you.
Good to see you. How you doing this morning?
Good, thank you.
He's a good friend to us here at Breakfast Television.
Yeah, that's for sure. A good friend to every face in the city.
Well, we are going to be doing something very interesting today.
Tell us about it.
We're going to talk about the newest in technology in getting that very quick facelift effect.
Ooh, so it's a non-invasive...
Non-invasive, almost painless way to lift and reposition brows, cheeks, and necks.
Okay, so you'll be working on Suzanne, right? Good morning, Suzanne. Good morning. How you doing this morning?
We should be prying too. We should find out what famous people in Toronto have had facelifts that he knows about, but has been sworn to secrecy.
Are you allowed?
Come on.
I wouldn't be able to talk much.
Yeah, that wouldn't make for much. That wouldn't make for much of an interview. I want to talk to Suzanne. Are you feeling at all scared about this, or are you happy and welcoming it?
I'm very much welcoming it. I've had it before, and it's great. It's non-invasive, and it really, you can see the difference immediately. So it's a good alternative to any kind of surgery, which I wouldn't want to do. So I love it.
We will be looking forward to this. We'll see you in a little bit. Good morning, everybody. It is 7:40. Don't you love short weeks? I love it. Stephen Mulholland is here. How are you, the good doctor?
I'm very good. Thank you very much, Tina.
Good to see you. And Sue, who's such a good sport today, you're going to go through some awesome procedure today, a little maintenance, as you mentioned. Take us through it.
Well, as people age, generally they undergo a little deflation, a droopiness of the brow and the cheek and the jawline. And there's many options. Most that I see are not interested in surgery. They want to start with something non-surgical. And we've had a number of technologies evolve over the last 3 years that can give you a non-surgical lift of the brow, the cheek, and the neck. What we're going to talk about today is the latest in those.
Okay.
So this is the actual applicator. Most people that come in and they think, ooh, is that going to be painful? Again, I like to reassure people, most of these new treatments are not painful. This marries a little infrared technology, infrared laser, with radio frequency current, which is electricity. Sort of like Thermage meets Titan. And those were some of the earlier skin tighteners that we've used in the clinic. So it's a very simple treatment. We use a little non-painless ultrasound gel. So this is a clear gel. And we do some treatments over the brow, the cheek, and the jawline. And after about 30 minutes, we'll be able to see a demonstrable 3 to 4 millimeter lift of all those areas.
So it only takes 30 minutes to complete, so we'll be checking in again in
It takes about 30 minutes. Very simple. You can see that the infrared energy, the infrared laser energy, and the electrical current goes into the skin. It rearranges the collagen molecules, those things that support the fabric of your skin, and it tightens. And at the end of the 30 minutes, I will be able to show that the brow, the cheek, and the neck are substantively elevated on this side of the face. Very simple treatment. She's got no topical anesthesia. So unlike some of our other earlier treatment technologies like Thermage or Titan, this is not painful.
This is incredible. You can pretty much get that done in your lunch hour, right?
Yeah, that's what it's designed for. Something you can come in, have a treatment, not be too swollen or too odd looking, put on your makeup and go right back to work.
So there is no recovery time and absolutely no pain.
There is little discomfort, and there's always a little discomfort, but it's what I call aesthetically acceptable, meaning that the outcome is worth it and you don't need to have any freezing or any topical anesthetic cream.
And there's no swelling afterwards?
No swelling. So when people come in, they can have the usual discussion of what they might do, little Botox, little filler. This bridges that gap of a non-surgical lift. Then there's thread lifts, using threads to resuspend. Then there's midi facelifts and facelifts. So there's about 5 rungs on the ladder of lifting your face. And this fits in a very important rung, which is a non-surgical option to re-lift and firm droopy elements.
Now, how long do the results of this treatment last?
One treatment, you'll get about 6-week result, but generally we do a series of 4 or 5, about once a month, and that treatment will last you up to a year. So you need a maintenance about once or twice a year to get that lift effect. And remember, it only takes about 30 minutes, so a 30-minute maintenance to maintain that lift is very acceptable to most women.
Can we get into cost, or?
Sure, it depends on the clinic that's offering. This is called the Refirm applicator. It's made by a company called Syneron, and it's a very popular system out there right now. So most clinics would charge between either per treatment, so between $350 and $750 a treatment, or a series of 4 or 5 might cost around $2,500. So you can get a lift effect for about $2,500. You get it done over about 4 or 5 months. You look good after the first treatment, and there's very little pain and almost no downtime.
And like you said, it can last up to a year. So this gets rid of lines on the, like you said, on the, is it the eye,
It's not,
above
so
the
much,
eyebrows?
it's not
or?
so much really for lines, it's for lifting and firming.
Oh.
Then lines is your Botox or fillers or treatment options like that. This is for lifting, this is for elevating the brow, elevating the cheek, and tightening the jawline.
Is there a certain age group that this is perhaps a little bit better for than over another? Or?
Yeah, I think the best candidates are those between 35 and 55. They're starting to look droopy, but they're not too droopy. And generally, if you can grab your jawline here, it just keeps going.
Oh no, I'm going to do it.
Go ahead.
Grab here.
And if you look in the mirror, here's the test. If you
That
pull out the jawline and you can't see your
Right.
earlobe,
Right.
you probably need something a little more substantive, like a mini lift or surgery. But if you've got an inch, inch and a half there, the brow's a couple millimeters droopy, this is a great treatment for you.
Really?
Yeah.
Well, we are going to check back in about 30 minutes. You said that's all it takes, right?
About 30 minutes.
And we'll be able to see the before and afters.
100% of the time. And this is the nice thing about the technology. This works 100% of the time. Whereas our earlier versions of lift technology, about 30% might see it and 30% don't, and 30% kind of This works 100% of the
I
time.
can't wait, Sue. 30 minutes, new face, back over to the newsroom. That's awesome. Welcome back to Breakfast Television. Here he is, the magic man, Dr. Mulholland. 30 minutes,
Yep.
done.
It takes about 15 minutes aside, so 30 minutes in total to do a whole face.
Okay, so you did the non-invasive. It is called the photo facelift.
It's photo firming using this refirm applicator.
Okay, so let's take a look at the before shot. I love this. Here's the before shot before he got his trusty hands on Sue. Still looks lovely if you ask me. But we're going to take a look at the after. Ta-da! Fantastic. Well done. Look how happy Sue is.
Well, I think if you look at what I was doing with the applicator, most women want that tail of the brow elevated, and you can see a very demonstrable change between. In fact, most women say you're going to do the other side, right? Because there's a big difference now between the left brow in its arch and the right side. Lifting and tightening with the refirm applicator her cheek to give a fullness, because as you age, you kind of deflate a bit and you lose a lot of that mid-face volume, sort of like air out of a balloon. You lose that nice fullness of youth, and this helps bring that cheek up, tighten the jawline, and then we'd go and obviously do the other side. So you can see quite a difference between one side and the other. It's fuller, there's a nice sweep on this side, her smile line's less noticeable, her corner of her mouth is firmer, and the jawline is firmer. And those are all the areas most women and some men want to achieve: a jawline lift, mid-face, and brow.
Can I get a quick, would you have the mic, Dave? I want to talk to Sue.
Generally, unlike most treatments we do in aesthetic plastic surgery, no topical anesthetic cream, really she could put on her makeup and go right back to work.
I don't see any redness or anything. How you feeling, Sue?
I feel great. Feels like a great workout on your face, but half of my face, of course.
And you felt no pain?
No, it's very tolerable. You can just lay back and enjoy it.
So for us women out there, what is it equivalent to? Is it like getting a wax, or is it like...
No, nothing like a wax. Nothing like a wax.
It's less
It would be
painful.
be like a massage, basically. It's a little tingly, but it actually feels quite invigorating once it's done.
So you feel no pain. You're ready to go
I'm
and
ready to
do
go.
your thing today.
I'm ready to go to work today.
Fantastic.
Now all she has to do is walk sideways for the rest of the day. Yeah.
Could we see another before and after? I always love these. Do we have this still? Yep, it's coming. It's coming. So there you go. That was Sue just over 30 minutes ago, if you can believe it. And now, ta-da! Isn't that amazing? Yeah. So they could come by and get this done. You have two
Clinics. I have one at
clinics.
First Canadian Place in the Business District and one in Yorkville.
Okay.
And you can combine this with something for brown and red discoloration. So you can get the lifting and tightening and the color correction. Because it's now October, it's the end of the summer. A lot of people were sinning with their skin in the sun and they have brown discoloration. So it's often common to combine this with a color correction photofacial and then this photo firming.
Do you mean like sunspots? That
Yeah,
sort of thing?
sunspots, brown spots, melasma, brown discoloration, and broken capillaries, the redness that people get when they've been out in the sun too much.
Looks fantastic. Thank you so much. Thank you for being such a great sport. You look beautiful. She looked beautiful before. Now back into Kev, see what's happening in the newsroom.